American healthcare system.
Hello, everyone. Today we are going to talk about the American health system and its current condition.
Healthcare in America continues to be a challenging and unperfected service. Between January 2020 and December 2021, life expectancy dropped in the US and other countries. With the pandemic a continuing threat to global health and well-being, we have updated our 2019 cross-national comparison of healthcare systems to assess US health spending, outcomes, status, and service use relative to other developed countries. The data presented comes from an analysis from the Organization for Economic Cooperation and Development, OECD, and other international sources. The study compared U.S. health system performance to the OECD average for the 38 high-income countries for which data are available. America's healthcare costs are among the highest in the world. According to the OECD, the United States spends more per capita on healthcare than any other country. In 2019, the United States spent $11,072 per person on healthcare, which is more than twice the OECD average of $4,643. There are several reasons for the high healthcare costs in America, including high drug prices. The cost of prescription drugs is much higher in the United States than in other countries. This is due in part to the fact that the U.S. government does not regulate drug prices. Administrative costs. The U.S. healthcare system is very complex, with multiple layers of administration and billing. This leads to high administrative costs, which are passed on to patients. Fee-for-service reimbursement. The U.S. healthcare system is largely based on a fee-for-service reimbursement model, which means that healthcare providers are paid based on the number of services they provide, rather than on the quality of care they deliver. This can lead to overuse of healthcare services, which drives up costs. Lack of preventative care. The U.S. healthcare system is focused on treating illnesses and diseases, rather than preventing them. This can lead to higher healthcare costs in the long run, as untreated illnesses can become more serious and require more expensive treatments. This health insurance is also hard to have for many Americans. However, there are several ways to acquire it. Health insurance. The most common way to access healthcare in America is through health insurance. You can purchase health insurance through your employer, a private insurance company, or through government programs like Medicaid, for low-income individuals, and Medicare, for those over 65 or with certain disabilities. Healthcare marketplaces. You can also buy health insurance through a healthcare marketplace, such as healthcare.gov. These marketplaces allow you to compare plans and choose the one that best fits your needs and budget. Community health clinics. There are also community health clinics that offer healthcare services to individuals who may not have insurance or who are underinsured. These clinics typically offer services on a sliding scale based on income. Hospital emergency departments. Hospital emergency departments are required by law to provide emergency medical treatment to anyone who needs it, regardless of their ability to pay. Direct pay or cash pay. You can also pay for healthcare services directly, either through cash payments or using a credit card. This can be a good option for individuals who do not have insurance or who have high deductibles. It's important to note that accessing healthcare in America can be complex and expensive. If you're struggling to find affordable healthcare options, consider contacting a local healthcare navigator or community health organization for assistance. Bringing healthcare costs down is a complex issue that requires a multifaceted approach. Here are some potential strategies for reducing healthcare costs. Increase access to preventative care. One way to reduce healthcare costs is to focus on preventative care. This includes measures like regular checkups, immunizations, and lifestyle interventions like exercise and healthy eating. By catching illnesses early and preventing chronic conditions, healthcare costs can be reduced in the long run. Promote value-based care. Shifting the focus of healthcare from quantity of services to quality of care can help reduce costs. Value-based care models, which focus on delivering high-quality care while minimizing unnecessary tests and procedures, have been shown to reduce healthcare costs while improving outcomes. Encourage competition and transparency. Increasing competition among healthcare providers and insurers, and improving price transparency, can help reduce healthcare costs by giving consumers more options and incentivizing providers to offer more affordable care. Control drug prices. High drug prices are a major contributor to high healthcare costs in America. Strategies to control drug prices could include allowing the government to negotiate drug prices, increasing transparency in drug pricing, and exploring alternative payment models. Address social determinants of health. Social determinants of health, such as poverty, food insecurity, and inadequate housing, can have a significant impact on healthcare costs. Addressing these issues through targeted interventions could help reduce healthcare costs by improving health outcomes and reducing the need for expensive medical treatments. Overall, reducing healthcare costs will require a combination of policy changes, system-wide interventions, and individual behavior changes. Thanks for watching.